Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Today I wanted to talk to you about this one benefit that a lot of people aren't aware of, and then when they are aware of it, they don't really take advantage of it. And kind of wanted to walk through the process on it because there are a couple hurdles that some people just aren't aware of. And this benefit is the Civilian Health and Medical Program of the Department of Veterans Affairs. The Civilian Health and Medical Program of the Department of Veterans Affairs. This is CHAMPVA. And for those that don't know, if you're 100% permanent and total, a couple things kick into place. One is Chapter 35 benefit, which is an education benefit, and the other is the CHAMPVA, which is it's an insurance for your spouse and dependents. So it is a benefit that's there. And I will tell you, it's a very easy application, okay? The application, and I'm going to read through this, but I'm going to kind of front load it with some of just the information here. So a couple cool things about it. You can use it in the civilian sector. You can also use it through a program with the VA, and I'll read through it, at actually VA facilities. So your spouse could go to a VA facility potentially and get seen there and get prescriptions and so forth, all at no cost, which is great. The other piece is with this easy application, again, the application is super easy, but when you do it, oftentimes we as the veteran are filling it out. You have to fill it out through the mindset of your spouse or dependent. So it is the spouse or the dependent who is filling out the application, and they're putting their information in that application. Now they'll put your information as the sponsor, but they're the ones who are going to sign at the bottom of the application because they're the one requesting the benefit. It's a spouse and dependent benefit. So that's just an important piece, because if you screw that up and you sign your own name and you send it off, then it could get rejected, right? If they figure out that that's your signature and not the spouse's. So important to know that. Another very, very important piece is this. If you have TRICARE, if you're a retiree and you have TRICARE, you're not going to qualify for this, okay? But if you are not a retiree, then this comes into play once you hit that 100% permanent and total. Now, whether you're 100% now or not, eventually you may be, and it's important to know about these types of benefits because once you get there, then you'll need to take advantage of this. Now, here's the interesting part. When you turn 100% permanent and total, you get some of the benefits like a retiree does. You get to go get your DOD ID cards for you and your family, that type of stuff, which is great. In order to have your spouse or dependents on CHAMPVA, they need to be listed as dependents in DEERS through the DOD side. So you'll need to, in my case, for example, I had to go to an ID facility, right? So when on base, went to an ID facility, made an appointment, had to go in there, had to, bring. Now, your spouse doesn't need to be with you. Your child doesn't need to be with you. But you do have to have 2 forms of ID for your spouse. So they have to give you, their driver's license and whatever else. But, I mean, a Social Security card or something. But my suggestion would be, if they can go with you, bring them with you so they can get an ID card at the same time because you're 100% permanent and total, and you would be getting your DOD ID, their DOD ID. If you have children over 10, their DOD IDs, and you would also, all of them would then be added into DEERS, and then you would be able to then turn around and apply for CHAMPVA. So let me read through it here, read some of the stuff about CHAMPVA, some of the things that they cover, so you'll know what it really entails. So again, it's the Civilian Health and Medical Program for the Department of Veterans Affairs, CHAMPVA. It is a comprehensive health care program for the spouse or widow and children of an eligible veteran. Through CHAMPVA, VA shares the cost of certain health care services and supplies with eligible beneficiaries. So let's see here. Are you the spouse or surviving spouse? This is on the VA's website of, or a child of a veteran with disabilities or a veteran who has died. If you don't qualify for TRICARE, you may be able to get health insurance through the Civilian Health and Medical Program of the Department of Veterans Affairs, CHAMPVA. Through this program, we cover the costs of some of your healthcare services, supplies. This is called cost sharing. Find out if you qualify for CHAMPVA and how to apply. It gives a whole list here. I'll go through these bullets real quick. It says at least one of these must be true of you, and there's 4 bullets. You're the spouse or a child of a veteran who has been rated permanently and totally disabled, so 100% P&T, for a service-connected disability by a VA regional office. Or you are the surviving spouse or child of a veteran who died from a VA-rated service-connected disability. Or you're the surviving spouse of a child, or you're the surviving spouse or child of a veteran who was at the time of death rated permanently and totally disabled from a service-connected disability. Or you're the surviving spouse or child of a service member who had died in the line of duty, not due to misconduct, right? And that they're not qualifying for TRICARE in some other sort of fashion, which is not usually true, but in the event that it is. So, let's see here. There's a whole other, there's some good information on the website, but we're going to skip over some of that stuff. And I'm going to get to the what benefits do I get with CHAMPVA. With CHAMPVA, you'll be covered for services and supplies when we, the VA, determine they are medically necessary and were received from an authorized provider. When providers are performing services within the scope of their license or certification, which I would hope that is the case, we consider them to be authorized. So here it says covered services include ambulance service, ambulatory surgery, durable medical equipment, family planning and maternity, hospice, inpatient services, mental health services, outpatient services, pharmacy, skilled nursing, and transplants. So that's pretty inclusive if you ask me. It sounds like insurance, right? Let's see. I did pull something else up here. So it says, this is the question. So it's a little Q&A section. And it says, are health care services at VA facilities available to CHAMPVA beneficiaries? So in other words, the spouse or surviving spouse and dependent children. Under the CHAMPVA in-house treatment initiatives, CHAMPVA beneficiaries may receive cost-free healthcare services at participating VA facilities. So what I would do is 100% rated P&T, bam, go to Deers, get everybody in Deers, right? Get their ID cards if applicable. Then apply for CHAMPVA. Takes a month or 2 to fully process. You should get a card in the mail. That card in the mail is going to be your healthcare card for your spouse's, healthcare card or independent children. And then call your local closest VA facility and ask them if they participate in that. And if they do, great. And if they don't, now you know. The last thing here on that, the CHAMPVA in-house treatment initiative, it's just another little blurb here. It says the CHAMPVA in-house treatment initiative is a voluntary program that allows treatment of beneficiaries of the Civilian Health and Medical Program of the Department of Veterans Affairs, CHAMPVA, at Veterans Affairs medical centers that have elected to participate in CITI, which is the CHAMPVA in-house treatment initiative. So the VA medical centers are the big ones, not the clinics, right? So by this blurb, it makes me think, okay, so it's just the big, medical facilities of the VA, not the outpatient clinics that are strewn across the nation. So you got to go to the bigger one. So, but call them up, check, see, just good information, good to have, good to know that it's there, especially with the cost of health insurance, especially if you're not working or if you're self-employed, those costs can go up substantially. So with that, we'll go ahead and end it. Thanks so much. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.